How to get the most out of video therapy, a whiteboard animation created by the HPFT IAPT digital team. We have put together our 5 top tips to help you get the most out of your video therapy session in response to the most common queries we receive. Let's get started.
Where should I be for my video session?
Tip 1. Find a private space. We recommend that you find a private space where you won't be interrupted or distracted and feel comfortable speaking about the difficulties you are having. We also ask that you remain in a fixed position where it's possible to ensure a good signal and connection. For example, it's not helpful to walk around the house or down the street during your session, unless specifically agreed as part of the therapy session. Please note, we're not able to offer a session if you are driving. This is because therapy requires your full attention. Your concentration will be distracted, putting you or others at risk.
What will I need for my video therapy?
Tip 2. Have your digital device ready. It is helpful to have a reasonable sized screen to clearly view the documents shared in therapy. Because of this, we recommend that you join your video sessions using a laptop. However, if this is not possible, a tablet or smartphone would also work. It is best to set up your device on a table or stationary and solid surface. If you are using a tablet or smartphone, you may want to prop it up against something or use a tripod if you have access to one. Please ensure you have good internet connection and signal. We suggest you have a phone ready to use as a backup communication device in case there are difficulties with your internet connection. If you're experiencing technical difficulties, please contact your therapist so that they are aware and you can come up with a backup plan.
How can I ensure that I am seen and heard by my therapist?
Tip 3. Think about the light and noise around you. When you are setting up for your video session, try to find a well-lit space so that your face is visible. Bear in mind that sitting with your back towards a window may cast shadows over your face, which means your features will not be clear and your therapist may have difficulty interpreting how you're feeling from visual cues. Similarly, setting up for your video session in a quiet space will allow you and your therapist to hear each other more clearly. You may prefer to use headphones with a microphone to improve the sound quality and minimise disruption from other noises. This also has the added benefit of making your sessions more confidential, as no one else can overhear what your therapist is saying.
What should I wear to my video therapy session?
Tip 4. Dress as you would for an in-person clinical appointment. We want you to feel comfortable in your video sessions with us, but we would respectfully ask that you dress as you would if you were seeing your therapist in person in a clinical setting such as a hospital or GP surgery. For example, avoid wearing pyjamas and make sure your top half is covered.
How should I prepare in advance for my video sessions?
Tip 5. Take 10 minutes to prepare for your session. Once you agree with your therapist on a date and time for your video session, we recommend that you block out the time agreed in your calendar. Being able to use the entire scheduled time without interruption will allow you to get the most out of your video therapy. Before your video session starts, you may want to take 10 minutes to set up your device and check there are no technical difficulties. We recommend that you have a pen, paper, and any documents related to tasks you have agreed to do. Please speak with your therapist about available options if you're unable to print documents at home. So, to get the most out of your digital therapy session, we recommend that you find a private space to talk openly, your digital device ready, consider any noise and lighting which may impact the extent to which your therapist can see or hear you, dress appropriately, and give yourself time to prepare ahead of the session. We hope you found these top tips helpful. In addition to these short how-to videos, HPFT IAPT offers a wide range of self-help resources and support options, including webinars, cognitive behavioural therapy delivered face-to-face, via the telephone or video call, computerised CBT, and other self-help videos. For more information, please visit the HPFT IAPT website or scan the QR code on the screen.